Do you get clicking, popping or grinding in your knee when you're going for a run? It may be that your kneecap isn't tracking properly. This is a model of the knee joint. The knee joint is a hinge joint which allows this flexion and extension range of motion. This top bone is known as the femur and this bottom bone is the tibia. In front of the knee joint is the patella or the kneecap, which is shielding the front of the joint. What happens when you're bending your knee during your run is the patella tracks up and down through these femoral condyles. Any sort of misalignment through this motion can cause some friction behind the patella here. That sort of misalignment can happen because of tight or weak muscles up through the quadricep muscles over the thigh and causing some pain, that clicking and popping sensation that you're getting through there. There are many reasons your kneecap may not be tracking properly through that knee. We talked about the muscle imbalances before, but there may be some biomechanical issues going on at the ankle or the hip, which may need to get checked out further. Today we're going to go over a simple strapping technique to get you some short-term relief, just so you can get through that next game or run until you do go and get it checked out. Joining us today, we have our physiotherapist Ryan to donate his knee to our cause. We're going to be using two different types of tape. First of all, we have the 38mm rigid tape, which is going to be doing all the work, the actual structural work in the taping today. We also have an underwrap or a fix-a-mole type tape, which is there to protect the skin. So we're just going to place our hyperallergenic tape on first. We're going to start just on the outside of the kneecap. You can have a feel through first, but we're just going to place it on the outside, and there's absolutely no pressure on this tape. This is just to protect the skin, and we're going to come over through there. Secondly, we're going to be using the rigid tape. We're just going to undo it slightly, and we're going to start just on the inside, so we're not coming on the outside of that hyperallergenic tape, and we're going to drag towards the inside to try and pull that patella over more into the femoral condyles. A firm amount of pressure, and I'm just ripping off there at the end. And what is a good sign is having a wrinkle on the inside of the knee there. That's the finished technique, guys. It should provide pretty instant short-term relief. If it's not giving you any relief, make sure you take it off. There's no point of it being on there if it's not being helpful. We really hope that this helps you reduce that clicking and popping while you are doing some activity, and I hope you take care of your knees.